Hello, I'm Navid Rekabsaz, and on behalf of my colleague from Johannes Kepler University Linz, Trip Database and Brown University, I'm going to present our resource paper TripClick, the log files of a large health web search engine. The interactions of users with search engines are important resources for research in information retrieval. They can be used for training and evaluating search engine models, as well as understanding and analyzing the behavior and use information need of users and many other scenarios. This becomes particularly important in domain-specific areas such as health, as the existing data and resources there are more scarce. In this paper, we are providing the click logs of a health search engine called Trip. Trip database or Trip is a web search engine in the domain of health that's exclusively used by medical experts. We are providing the click logs of this search engine from 2013 to 2020, which comprises 5.2 million interactions of the users in the sense of the click logs with the search engine. We then use also these log files to create a novel health IR benchmark. It's a very large one. It has around 7,000 queries, 1.5 million documents, and more importantly, 2.8 million relevancy information between query and document, which makes that a very good fit for research on deep and neural IR models. Let's have a closer look at the content of these log entries. We see here that every log entry has the information of the time that the query is submitted to the search engine, the session that it appears in, the list of the document that's retrieved by the search engine, and the document that is clicked, and some information about this click document. We have around 5.2 million log entries, click log entries, that are divided into 1.6 million sessions, around 3.3 query document interactions per session. If you look at the distribution of the number of times that COVID-related queries are submitted to the search engine in these log files since 2018 and also in the months of 2020, we can see that the peak of information is in the April of 2020, which shows the recency of this resource, this data resource, perfectly fit for research on emerging topics such as COVID-19 pandemic. So we use these log files, and then we created an IR benchmark. This IR benchmark is created based on approximately 80% of the full data sets that is about the Medline articles. The benchmark has around 1.5 million documents. These are the titles and abstracts of the articles extracted from the Medline catalog, around 700,000 queries, and 2.8 million relevancy data points. These relevancies are estimated using two click-through models, raw and DCTR. Since all the logs are provided, more complicated and more advanced click-through models can be created using the log files. So if you look at the distribution of the queries and number of times that each query is submitted to the search engine, we see that there are a lot of queries that are submitted very rarely, and there are a few queries or sub-queries that are submitted more frequently to the search engine. We therefore create three groups: head, torso, and tail. Each of them comprises of the specific queries. Head are the most frequent queries, and tail are the least frequent queries or the rare queries. And we have around 6,000 queries that are very frequent, and then we have many queries in tail, around 600,000 queries that are very rare. So this separation between the queries provide studying the different aspects of the search engine. So given this benchmark, we also provided files for training and evaluating, training neural models and evaluating them. We randomly select, for each of these groups of head, torso, and tail, we randomly select a set of 1,175 queries for validation and test. These QRLs for the validation sets are published publicly, but for the queries of the test sets, the corresponding QRLs of them are kept internal. That's used for evaluation of their leaderboards. All the rest of the queries are used for the training. So we also provide the training triples. This is created based on around 1.1 million positive query document pair, which is also combined by, for every positive query document pair, we have 20 randomly selected negatives, which at the end, the training, the number of items in this training triples that's provided is around 23 million, which is perfect for training deep and neural IR models. So then we also use this evaluation benchmark and this training and training data points to train several different neural IR models, and we can see the results on NDCG, MRR, and recall for validation and test sets here. Let's have a look first at the results on head. As we can see here, in comparison to classical baseline or exact matching baselines, the neural models significantly improve the result with quite large margins. And as the complexity of the models becomes higher, the results are also getting better and better. This is somehow similar to the result that we see on the human annotated collections such as MS Marco, which also shows the value of this collection for studying neural and deep IR models. These models are indeed just a set of baselines, and definitely more advanced model can improve these results. If you look at the result of torso, we also see quite similar trend. However, in comparison to head, the difference of the improvements becomes more moderate. And when we look at the result of tail, it's apparently much more challenging task. Most of the neural models cannot improve the classical baselines, and also only the TK model has significantly improved all of the other models. So to summarize this talk, we are providing a novel large-scale resource. It's 8 years log files of TRIP database search engine. It's a perfect benchmark for training deep IR models and evaluating them, particularly in the health domain. It's in general a rich resource for research on health IR, neural IR, studying user information need and user behavior, also in areas such as assisted systematic review, as well as click-through models and many other areas. It's already integrated in few IR libraries, and it's accessible for research purposes, and to access that you submit this access request that's available in the web page of TripClick. There we have also leaderboards, and we are looking forward to your submission. It's a place for tracking the progress on this collection, and also facilitates the distribution of knowledge in the community. Find more information in the webpage of TripClick, and thanks for listening.